Antifungal susceptibility testing, therapy, and prevention. Antifungal susceptibility testing should be performed following the Clinical Laboratory Standards Institute or CLSI guidelines, which are regularly reviewed and updated to ensure accuracy and clinical relevance. Although antifungal susceptibility testing is costly and time-consuming, it provides valuable information for determining antibiograms within healthcare institutions. This data is particularly important for managing patients with refractory fungal infections and for guiding treatment decisions in invasive candidiasis, where resistant patterns can significantly impact therapeutic outcomes. Interpreting antifungal susceptibility test results can be complicated by several factors. The patient's physical condition, particularly their immune status, plays a crucial role in treatment outcomes. The type of infection and the ability of the antifungal drug to penetrate the infected site, so for an example, an abscess, can also influence the effectiveness. Additionally, the drug's dosage and mechanism of action must be considered. Variations in susceptibility testing methods and the serum levels achieved by the drug can affect interpretation. Furthermore, isolates of the same fungal species may exhibit different minimum inhibitory concentrations or MICs due to previous drug exposure or genetic mutations that confer resistance. This is a list of commonly tested antifungal agents in susceptibility testing. We have the polyene macrolide antifungal, as amphotericin B has been long considered the standard drug of choice for treating fungal infections. However, resistance to amphotericin B varies depending on the genus and species of the infecting fungus. It is typically administered intravenously to treat deep-seated and systemic fungal infections. A notable adverse reaction associated with this drug is renal insufficiency, which requires careful monitoring during therapy. Fungal species known to exhibit resistance to amphotericin B include Aspergillus terreus and the Fusarium species. Nystatin is another polyene antifungal commonly used topically to treat oral and vaginal candidiasis due to its effectiveness against Candida species and minimal systemic absorption. The azole antifungal drugs consist of two main groups, so the imidazoles and the triazoles. These drugs exert their antifungal effects by disrupting the fungal cell membrane through inhibition of ergosterol synthesis, an essential component for membrane integrity and function.